Hello everyone. Greetings from Sri Devi from beautiful Spotless Skin team. I'm all very sure that you're all keeping very safe, and please vaccinate yourself when you venture out and when you have opportunity. Also, regularly wash your hands and please be safe. We all know that there are a few must-dos in skincare. One of those is usage of sunscreen and daily skincare regimen. Today, we not only need protection from sun rays, but also from IR and visible lights. When we are indoor at our office or home, we are exposed to visible and IR rays due to a lot of time spent in front of screens. We spend most our times in front of a mobile or a TV or a laptop and other accessories which emits harmful rays and can further trigger skin related problems. So we need to a broad spectrum sunscreen which suits and protects our skin from these harmful rays. So today we have a very experienced Dr. Varun Tyagi live from Delhi to enlighten us on the topic of sunscreen and moisturizer, a vital role in acne. Dr. Varun Tyagi holds expertise in the field of dermatology, cosmetology, and hair transplant surgery with an experience of 15 years. Dr. Varun Tyagi practices at Perfect Tyagi Hospital in East Delhi. Patients who visit Dr. Varun Tyagi really come out with a lot of confidence and positivity in life. Thank you so much for joining us today. Thank you, Doctor, and happy Doctor's Day to you. It's indeed a great honor to meet you on this particular day. And today, I'm sure we are going to be enlightened with a lot of aspects regarding the cosmetology and how to take care of our skin. So when we talk about sunscreen, it's probably one of the very commonly used word, but do we know the importance of sunscreen as much? So is it like really enough to protect ourselves from the sun's rays, sir?
Okay, so first of all, a very warm welcome to all your viewers from my side. And this is a wonderful day. It's Doctor's Day also. I thank you and all the team for wishing me on behalf of whole doctor fraternity. I thank you all. And now let us begin with our today's topic. As you say that sunscreen is the most commonly used cosmeceutical, and we hardly know anything about it and we hardly talk about it. And yes, that's true, because of lately in the last 10 years, the scenario has completely changed. With the digital revolution, we are more exposed to UV rays, and our exposure time has increased manifold. While people usually had a concept in their mind that sunscreen is meant only for outdoors or for going in for swimming and outdoor activities or at beaches or at hiking for a hilly place. But now people have come to understand that it is very important for using a sunscreen while sitting in front of a laptop or a mobile phone or while doing their desk job. So yes, things are changing. People are getting more and more aware, and they are actually coming to know about the qualities of a good sunscreen, what type of the skin they have, and what type of sunscreen will be best for them. They do inquire about it, and we get a lot of questions in our OPDs. And yes, there has been a great sense of awareness about this product now.
Okay, sir. But is the sunscreen enough to protect ourselves from the sun rays?
Yes. While we speak about protection, sunscreen is the only thing which can protect us from all the harmful rays which are now around us and which are we are actually exposed to. So a good sunscreen with a proper SPF factor and suitable for your skin type is sufficient for protection.
Okay, doctor. Thank you. And you were talking about people being aware of sunscreen and which one will suit them and everything. So how do we choose which is the right sunscreen?
Right. It depends upon two main factors. First, do you have any comorbidity before using a sunscreen? And second, what is your profession? Like if somebody is working in an outdoor activity, or if somebody is doing a field work and is having a lot of sweats, like in southern states where there is a lot of humidity around the year, and if somebody is working in field, he definitely needs a water resistant sunscreen. And if somebody is working on hilly areas with cold environment, not much of humidity, they definitely need a higher SPF sunscreen. Probably that can be a lotion based. So there are different professions, different requirements, different skin types, and that your physician or your doctor, dermatologist is the best person to decide which type of sunscreen you would be requiring.
Okay, doctor. And while you were talking about this professions, I could understand, but what is it to do with comorbidities? Could you please elaborate?
Yes. Suppose you
Yeah.
are already having acne problem and you want to
Okay.
use the sunscreen. Most of the sunscreen are having some oil and silicone base. So those sunscreen will not be suitable for you. Or suppose you are already having polymorphic light eruptions or allergy to UV rays. Then a particular set of sunscreen is required for you. The common sunscreen, the word sunscreen is broadly used for anything which contains SPF. So if you are already having a disease or condition which is actually impairing your normal skin functioning, you need a special kind of sunscreen. And today we have different sunscreen for different needs. So that is how
Okay.
we decide.
Okay. So what is SPF, sir? Could you tell us what SPF actually means?
Actually, SPF is a sun protection factor. And
Okay.
SPF is not only limited to your sunscreen lotions. Everything has a SPF. Like the clothes which we wear also have a SPF. They have a
Oh,
SPF of around 6 to 8, depending upon what type of cloth you are wearing. So even your makeup, the foundation you use also have a SPF of 3 to 4. So we have SPF in everything. Sun protection factor is there in every blocking thing, everything which is blocking your skin from direct rays. So it depends how much SPF you need and what are your requirements. So it's not only sunscreen, it's there in most of the things.
okay, doctor. Thank you. And is there any difference in the SPF? And these differences we see, right? The SPF 30, SPF 100, and all of that. To my limited knowledge, I feel everything is the same. But is there any difference between these, or is it just a product gimmick or something like that?
See, mainly it depends upon your skin type and the level of exposure. In India, we usually require a sunscreen of SPF 30, and in India, as per the guidelines, on any sunscreen there cannot be a mention of more than SPF 50. You can mention SPF 50 plus, but then you cannot label it 70 or 80 or 90 or 100. It's something
Right.
like if you want to make a tea sweet. If you want to make tea sweet, you'll put 1 teaspoon of sugar or 2 teaspoons, and that is sufficient. And if you keep on putting 3, 4, 5, that won't add to the taste of the tea, right? That's again the scenario in case of SPF. More SPF does not mean more protection, right?
Okay, okay, doctor. So, as you mentioned, you were saying even the makeup lotions or the moisturizers sometimes might have SPF. So, some people might think that my lotion has SPF, so that is equivalent to a sunscreen. So, do I need a separate sunscreen?
That is what is very important to know how much SPF your product is providing. Most of the cosmetics give SPF of 4 or 5 or 6, while we need a minimum SPF of 30, which cannot be achieved by a normal cosmetic. So that is why we need a separate sunscreen.
Okay, okay, doctor. And there is these differences in the SPF that you had mentioned, right, sir? So, what is the minimum level of SPF that is available, and what is the maximum?
Minimum we have 15 SPF in our country, and maximum is 50, 50.
Okay, okay, doctor. So, as far as sunscreen is concerned, how to apply, how much to apply, and what is the frequency in which we need to apply? These are some things that we don't know. We just think it's like a
Yes.
minimum moisturizer and just do it, on a continuous basis.
The proper quantity is 2 gram per centimeter square, and roughly if you calculate, that comes around a 1 rupee coin in your palm, and if you rub it, then that should cover the area of 2 palms, right?
Okay.
So that means it's sufficient for full face. 1 rupee coin amount of sunscreen. But most
Okay.
of the people don't use it that way because it becomes very sticky and it becomes difficult to apply. But that is the appropriate amount you require for proper production. And every 3 hours it should be repeated, right?
Okay.
Ideally. But if you are not going outside, if you are sitting in a AC chamber, not going anywhere, so 2 applications will be sufficient.
Right. Okay, doctor. And when we talk about sunscreen, it's not just about wearing it when you go out. So now they say we need to do it or use it even when we are at home. Why is
Yes.
it so?
Because we are surrounded by gadgets, we are surrounded by CFL lights, UV rays, we have mobile phones, laptops, they all emit UV rays, and which
Okay.
are the main culprit for aging, wrinkles, and all these things. So when you are inside, you are more exposed to these things, and we need a protection. That is the purpose of the job of sunscreen.
Okay, doctor. So what are IR and visible lights?
Uh, Now we had a concept in last decade that sunscreen is going to protect us from UV rays, and that is sufficient for us to prevent aging and all skin related issues. But in last 10 years, we have come to the conclusion that infrared rays, those which are coming from the heat furnaces, the burners, the stoves, the whatever things we use in the kitchen, or the heating instruments we have, they are causing equal damage. And then the concept of IR protection was developed, and now we have sunscreens which give us IR protection. In the same way, we initially had sunscreen only for UVB protection, but now we have UVA protection also included in various sunscreens.
Okay, doctor. So what type of sunscreens protect us from these kind of IR rays?
These are the sunscreens which have a spectrum which basically protects us in the infrared range. So the sunscreen we initially had a very narrow band, means they were only protecting against a very narrow range of UV rays. But now with inclusion of infrared, the spectrum has become broad, and the sunscreen which protect you from infrared is specifically mentioned it that IR protection is there. If it is not written that IR protection is there, it won't protect.
Okay, doctor. Thank you for that. Now I'm taking a couple of questions from the viewers. Ms. Tripti Pandey, she has a question. She is asking, she's saying, hi, I'm 22 and I have a fair skin tone. And now my skin tone has changed to a bit dark complexion. So she's kind of probably tan. So how can I get fair complexion? Please help me with some home remedies.
Right. First of all, with the aging and with our activities, when we actually involve in outdoor activities and more of laptops and mobile phones, your complexion is definitely bound to go down. So you should be more cautious while using these things. Apply a good sunscreen, and when you have developed tan, then you should be using de-tanning agents. There are various de-tanning agents that you can find in the market. There are glycolic acid peels, there are glycolic acid lotions also available, and a lot of vitamin C intake has to be there. She must increase vitamin C like oranges, amla, and all these things, if taken properly, in a few months she can have her complexion back.
Lovely, sir. Thank you. She has another question. What is the difference between serum and moisturizer? Is it necessary to use both?
No, moisturizer is something that only keeps your skin soft and supple, and it retains the moisture content of your skin, the water content. Whereas a serum is a particular set of cosmetic which is meant for a targeted approach. Like we have anti-aging serums, which will basically smoothen off your fine lines and wrinkles. So there, the serum's application is only for a specific purpose. So it is not necessary. But moisturizer is useful for general day-to-day maintenance of the skin, especially for people having dry skin.
Right. Are moisturizer and serums, like, for example, are they replaceable in the sense,
No,
if I'm
no,
using a serum? Okay.
no, absolutely not. Because moisturizer serves a broader purpose, and serum is only meant for a specific purpose. Serum can never be used as a moisturizer.
Okay, thank you, doctor. And the next question is from Miss Ginni Sharma. What is more important, a moisturizer or a sunscreen?
See, that depends if you are having any comorbidity except a generalized maintenance. If you see from a normal layman's perspective, sunscreen is much, much more important. But if somebody is having a dry skin condition, if somebody is having atopic dermatitis, or somebody is having a disease which needs moisturization, then moisturization takes priority compared to sunscreen. Because sunscreen can only be applied to a skin which is normal in texture. If your skin is not normal, your sunscreen cannot be applied, right?
Absolutely. Thank you, doctor. The next question is from Mr. Abhishek Sen. Does toothpaste work on pimples?
No.
No. Okay, straight away. No is the answer. And Gindi Sharma has another question. What is, I think she's posted the same question again about which is more important, if it's the moisturizer or the sunscreen. And the next question is from Miss Shivani Mishra. Which SPF is best for dry skin, doctor?
30 SPF is good for most of the skins in India. Most of the skin type in India lie between type 2 to type 4, and 30 SPF is ideal.
Okay, doctor. And as far as these pigmentations are concerned, what are they? Does it come under, fair skin becoming darker, or pigmentation has to be treated separately?
Pigmentation has to be treated separately, but here we are talking about something much broader, much preventive. If we do not let pigmentation to set in, then that is the best thing. So sunscreen is something which will not let you go into that space. So if you use a good sunscreen regularly, I'm pretty sure you won't have to go for a pigmentation treatment.
Okay, doctor. The next question is from Ridula Golwalker. How can I stop my skin from breaking out? Even if I apply a sunscreen, is it okay to apply sunscreen when my skin is breaking out?
Skin is breaking out means acne, she means.
Yeah, maybe. Okay. Yeah,
so
I think that's what she means.
Yes, she must use the non-oily sunscreen, a sunscreen which is matte based, and aqueous gel sunscreens are very much available in the market, and they are the ones she should be using, because if she uses a normal oil based or silicone based sunscreen, she'll again have acne.
Right. And also these serums, people with acne, is it okay for them to use serums?
No, absolutely not. You should never use a serum unguided if in case you are having any skin condition, because they may worsen it.
Okay, doctor. And are there a possibility that using of serums can cause some kind of, like you said, if it is not guided, what can it lead to?
It can lead to many problems. Like some serums are basically containing some oil-based ceramide substances, which can be not good, which can cause acne problem in people with the oily skin. There are certain serums which are very dry, like vitamin C serums and glycolic acid. If a atopic person or a person with a history of allergy uses them, he will have a dry skin, parched. That will be like a burn of the skin. So I would not recommend anybody to use any serums on the over the counter just without prescription or without guidance of a doctor, because sometimes you may land up in a very bad situation because of that.
Oh, thank you so much, doctor. That kind of awareness is really required. Thank you. And applying sunscreen makes makes my skin really oily and greasy. What do I do? Do I need to change and select a new one?
She needs to change the sunscreen. She needs to use a matte finish sunscreen. Preferably, she must use a sunscreen which is having aqueous gel base, so that will not cause this kind of problem.
Okay. And what about people who wear makeup and go outside? Because they wear a sunscreen before they wear the makeup. But after that, if they have to reapply every 3 hours, it may not be possible. So what do they do?
They should use a sunscreen base while using makeup, and on that they can use the makeup. That's not a problem. And most of the time, these sunscreens which are now available in the market, they are more long lasting. And if you are not going outside in the sun or like exposed environment, they are good enough for protection for more than 5 hours. So in that way, they can be helpful. And most of it, your makeup will also provide some SPF.
Okay, thank you. The next question is from Aman Arya. There are a lot of sunscreens available in the market. Is there any difference between the normal ones and the medicated ones?
Yes, there are a lot of differences. The normal ones, first of all, they are not, the SPF factor mentioned is not authentic. Sometimes they mention 50, sometimes they mention 40 or something like that, but there is no authenticity. Second, they are mostly oil based, so they do not suit every skin condition, every skin need. And what I have seen in my personal experience are they are not good enough for the protection. So the professional sunscreens which are available are much better, and they are much, you can say we can trust more on them. We have a level of confidence while using them, while in case of OTC products we cannot be sure about it.
Okay, doctor. And Mr. A. Raju has a question. How can I find out my skin type?
You have to visit a dermatologist. You can find out your skin type.
Okay. Okay. So the next question is about is any issues in my hair can cause problems in my face? Is there any
Yes,
issue? Yeah.
most of the people who have hairs which are very oily, they can have a lot of acne on their face, and especially people who have a habit of applying a lot of oil on their hairs and leaving it overnight, they will definitely have acne and acne form eruptions on their whole face. So yes, it may cause.
Okay. Does dandruff have any effect on the face? Does it make my face my face also dry?
Yes, dandruff does have effect on your face, and applying oil also increases dandruff.
Okay.
Contrary to popular belief, what people feel in India, that if you have dandruff, you are having dryness, and if you apply oil, then your dryness will go away. That's absolutely wrong. It's the other way around. The more
Oh.
oil you apply, the more dandruff you have.
Oh, okay, doctor. That's something that even I didn't know. And thank you for
Most of the
that.
people
So,
don't know.
thank you, doctor. So, when people have dandruff, how often do they need to have hair wash?
I usually recommend females to wash their hairs 3 days in a week, and males I recommend daily.
Okay. And the next question is from Mridula Golwalker. Since I lead a busy life, I need to keep my routine simple. What are the absolute skincare basics?
Just use one product, one good sunscreen for your face, and that will be it. That nothing else would be required.
Okay, so once we use a sunscreen, sometimes when we go out, like you had mentioned earlier, if it is a liquid base, then we feel greasy or something like that. Is that why people use something on top of it to conceal it?
Yes, most of the time, because they don't know which is the perfect sunscreen for their skin type, so they end up using a very costly sunscreen, which is actually not useful, not meant for them.
Okay, and there are also some sunscreens available in the spray type. So is it effective to use that?
No, absolutely not. And in Indian market, most of them have failed miserably. They do not provide a uniform protection. And I would recommend that if you are going to use something like that, so first use it in your home before taking it with you for a journey or for a vacation. Sometimes people go to beaches and they use those sprays, fancy sprays they have, and they don't work at all.
Okay, doctor. And when we go to the beach, like you had mentioned now, the chances of getting tanned is really high. So
Yes.
people just try and use sunscreen for their face alone, but the rest of the body gets tanned very badly.
You must cover your whole body with a sunscreen, and in that case your sprays can be helpful, but they are less effective.
Okay, doctor. So when some question about the hair, where some people have dry hair and that leads to split ends. So what do they do for that?
See, first of all, we must find out the basic cause of this split end. Split end do not happen regularly. They are because of nutritional deficiencies. So there are certain tests which needs to be done and found out that whether person is having deficiency or whether diet is appropriate or not. Is there any kind of stress going on? So these are the things that dermatologist will look into first, and then after that only we will take some action.
Okay. Is there any specific morning routine? So there are people who follow a particular morning routine and then a different night routine. Why should it be different from a morning and the night?
No, there is nothing like that. This is just
Okay.
a gimmick.
Okay. So there is no thing called a morning or a night routine at all. So you don't really need to, because some people say when you're sleeping, you need to, like you had said earlier, yes, it is important not to use serums without a doctor's guidance, but there are some products that are being promoted saying that this is especially for the night and this is especially for the day.
See,
So,
most of the time, these are marketing gimmicks made by companies to make you feel that you actually need something for routine. And that is how people end up spending a lot of money. And that is why these big cosmetic companies are making billions of dollars. And basically, we do not need any such kind of things. Only thing you require is a sunscreen in the morning and maybe a moisturizer in the evening. That is all you need.
okay. The next question is from Mr. Goldie Kurana. Please help me with a sunscreen that lasts for a long time, especially for acne prone skin.
See, there are many good sunscreens available in the market. Mr. Khurana should visit a dermatologist once, get his skin analyzed, and he should get a good prescription, because this is something which he will be requiring desperately for the rest of his life.
Okay. And doctor, do you think people in India are aware that a visit to a dermatologist is also as important as visiting their general physicians? Because usually people visit dermatologists only if there is any issue with their skin, or some kind of an allergy or something that they cannot treat at home. But how important is it to visit a dermatologist and know about what their skin is?
See, it is important because if you don't know what your skin type is and you're using some products which are actually not meant for your skin types, you will end up losing your money as well as your skin. So I would strongly recommend that people should go consult their dermatologist and have a proper prescription. Also, while visiting a dermatologist, you should also see whether you are actually visiting a proper dermatologist or not, because these days many parlors, saloons, and various non-dermatologists are also practicing in guise of dermatology. While they are not qualified to do, or they do not have the proper knowledge, they actually end up making people lose their money and faith in doctors.
Okay. What is a broad spectrum sunscreen?
Broad spectrum sunscreens are the one which we talked about, those which have UVA, UVB, IR filters, which protect us from all these rays.
Okay. That was from Ahana Bhakshi. And the next question is from Abhishek Sen. Does drinking water help acne?
Yes, definitely. Drinking a lot of water helps you have a very good, a very bright and a wonderful skin, and it does help in getting rid of acne as well.
Okay, doctor. Now, if you could kindly educate our viewers about sunscreen and moisturizer and its vital role in acne.
Right. See, sunscreen are one and the foremost cosmetic agent required by every individual who is working, non-working, at home, or going outside. And that is the only thing you need while using in the morning, which can protect your skin 365 days a week, a month, a year, and you should use it every day. Right. Now, coming to moisturizer, moisturizer is also important. But now, if your skin is oily, or if you are not having any kind of dryness or any issues, there are times when you don't need moisturizer, and only winter months, or maybe you can say 4 or 5 months in a year, would be those which you will be using these moisturizers. But it's not the case with sunscreen. Sunscreens are meant for 365 days in a year, and they have to be used daily by everyone. And you can also visit our dermatologist and get prescribed different sunscreen for different weather according to your skin type. So you don't have to regret using a wrong sunscreen at the wrong time.
Okay, doctor. Like you mentioned about using the wrong sunscreen. For example, I used to go out, and so I used a sunscreen that was solving that purpose. But now I work from home. So is there a necessity that I need to change the sunscreen based on that?
Absolutely not. If you are comfortable with your sunscreen, then you should continue with that.
Okay. Thank you so much, doctor. And your suggestions about the skin tans that happen because of sunscreen. What is the treatment post that? So what do we do if our shade is become different?
We have a lot of treatment modalities. The simplest one I mentioned earlier was a lot of vitamin C and using a good sunscreen, using de-tanning agents like glycolic acids, kojic acids. We have a lot of preparations available in the market. Should once consult your doctor. If required, you can go for chemical peels and lasers also.
Okay, doctor. Another question from Kanika Arya. What precautions should one take while using a sunscreen? I think you've already given the answer, but if
We
you could
already
just,
discussed.
yeah.
Yes.
Yeah, thank you. And we spoke about sunscreen, we spoke about acne prone skin, and the importance of moisturizer today. And also, is there anything else that one needs to take care while wearing makeup? Like for people like me who are in the field of media, who wears makeup on an everyday basis, is there anything that they need to focus on?
Yes, while choosing your makeup, you should focus on two very important things. Rather than focusing on brand and the pricing, always focus for the compositions, and always look for what kind of makeup is suitable for you, because it's always mentioned on makeup these days that it is water resistant or it is not water resistant, whether there is it's an animal based product or it's a plant based product. So do look in for these things, and do test every makeup before using on your face. Put it on your hand or somewhere and just test it for 1 or 2 days.
Okay, doctor. And does use of lot of cosmetics lead to any kind of issues in our body, or some people say it is cancerous and stuff like that? Is it true?
Yes, there have been many theories like that, but a definitive conclusion has never been drawn. But there are so many theories which suggest using a lot of cosmetics can cause, cancers and all, but there is no definitive study.
Okay, doctor. Is it important to use sunscreen even on rainy days?
Yes.
Okay. The next question is from Miss Aman Arya. About moisturizer, people think that Vaseline and coconut oil is a good lubricant, but sometimes, it also causes acne. How do I choose the right moisturizer in acne-prone skin?
The same thing that we discussed regarding the sunscreen. Basically, it's your skin type which decides what kind of moisturizer or cosmetic you need. So if you have a dry skin, there are different set of moisturizers available for you. If you are having a oily skin, there are different set of moisturizers. And if you have a normal type of skin, there are different set of moisturizers. So it depends upon your needs. It's not necessary that every person will be happy with Vaseline. So there are different needs and different availabilities. Even Vaseline provides very long SKU. There are 5 or 6 types of Vaselines. So it depends on person to person, right?
Okay, doctor. What are the problems that I will face if I do not use a sunscreen at all? So what could it lead to?
Every kind of skin problem you can imagine, like acne, pigmentation, burns, every kind of.
Okay, doctor. And once if I started skin routine, and if I do not continue, is there anything that I would face?
I do not recommend, or I would not suggest anybody to follow a skin routine or something like that, like night cream or day cream, without any specific need. It depends. If you have a specific need like anti-wrinkle treatment or anti-aging treatment, then only you should go for it. And that too, you should go for a product which is well tested and which has authenticity. Don't go for over-the-counter products. They are usually not working. They are usually not very effective.
Okay, doctor. Thank you for enlightening us on a lot of aspects today. It was really, really very informative. But just a last few questions about sunscreen and moisturizer, sir. Are there any matte finish moisturizers available which does not make?
Yes, there are matte finish moisturizers available for oily skin. And in that also we have different type of moisturizers. Matte finish moisturizer for normal skin, matte finish moisturizer for oily skin, matte finish moisturizer for acne prone skin. We have different types of it.
Okay, doctor. And once there is a breakout of acne, what could it lead to? Could it lead to another acne nearby?
Yes, it may, because inflammation, once it starts, it spreads to other areas also.
Okay. And thank you so much, doctor, for all your lovely answers, and it was really, really very informative. And Dr. Varun Tyagi, it was absolute pleasure talking to you this evening. Yeah, thank you so much, and we look forward to many more sessions like this with you, sir. And thank you. Thank you, viewers, for your excellent participation. We have received a lot of questions during today's live, but due to lack of time, only a few are answered. The rest of the questions will be answered by our doctor through our FB page. And for more information on how to keep your skin healthy and look beautiful, stay connected onto our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Insta. Thank you so much, everyone, and good day to all of you.
Thank you.
Thank you.